You're listening to episode 160 of Present Moment. Welcome to Present Moment, Mindfulness, Practice, and Science. I'm Ted Meissner. Present Moment is a podcast with interviews, conversations, and roundtable discussions. We speak with mindfulness researchers about their newest findings published in peer-reviewed science journals, teachers about their understanding and methods as they work with students of mindfulness, authors about their books and interests, and we also speak with everyday practitioners. The website presentmomentmindfulness.com has show notes for each episode along with resource materials. David Treleaven returns to the podcast to speak about his recent course on trauma-sensitive mindfulness. If you're listening to this podcast and find value and insights from what is shared here, know that this can only be sustained with your generosity. Please take a moment, go to presentmomentmindfulness.com and click on Make a Donation if you value these conversations, which can't continue without your contributions. Thank you for your help and your support. Mindfulness teachers are becoming increasingly aware of the need to be informed about how the symptoms of trauma can show up in the participants of our programs, what to look for, and how to best support students. But it's more than reading a book, and having the opportunity to learn from those who specialize in this field is an indispensable aspect of teacher training. David A. Treleaven, PhD, is an educator and trauma professional whose work focuses on the intersection of trauma, mindfulness, and social justice. Trained in counseling psychology at the University of British Columbia, he received his doctorate in psychology from the California Institute of Integral Studies. He's been studying mindfulness for 20 years and has a private practice in the San Francisco Bay Area. Our guest today returning to the podcast is David Treleaven. David, welcome back. Nice to see you again.
Thanks, Ted. It's awesome to be back. I was trying to think of when you were one of the first people that I ever talked to about the topic, and I was trying to remember when that was. Was it a year or two ago, maybe?
Well, interestingly, the first time we talked was in 2014. So it was
Oh, wow.
6 years ago.
Yeah.
And then again in 2018, just two years ago, as of this recording, 3 days from now.
Oh, wow. That's amazing. Yeah, you've been a real steady connection point, both in your teaching. I know this is something you care about, and so it's cool to get to reconnect with you.
Yeah, it's good to speak with you as well. And I want to dive into our main topic, which is talking about your recent online course on trauma-sensitive mindfulness. But before we do that, let's just catch up a little bit, since it has been a couple of years since the listeners have heard from you. I wonder if you want to just catch us up on a few things. And of course, that includes, oh, and I did this course. So how have
Yeah.
you been? What's been going on?
Yeah. Thanks for asking. It's been, in this moment, honestly, it's without knowing when this will actually be reaching the audience. It seems like quite a time here in the U.S. and internationally, and I've been here in the U.S. for about 11 years now, and so it's a particular moment in my life, and the book came out 2 years ago, and it's been a bit of a wild ride. It feels like it was a wave that, by virtue, we've talked about this, but by virtue of my own personal experiences and just also my own interest in the field around the relationship between mindfulness, meditation, and trauma, this book coming out, and then really just riding a wave and saying, okay, like where can I be of service, and who's interested in this, who's pushing against this. And so it's been a really interesting couple years of just surrendering to seeing where this conversation is happening, and who are the people that are interested in having it. And you were one of the first people who really said, hey, this has been on my mind about best practices around trauma and extreme stress. And honestly, there hasn't been a ton of pushback around the topic. I think when we talked a couple of years ago, there was a lot of unknown for me.
Mm-hmm.
And it might have been you who actually said this, but someone said, I think the topic, or at least your work around this topic, is provocative, but it's not controversial. In some ways, it's a common sense approach that hey, we're getting more complex around mindfulness programs and interventions. Great, let's have conversations about who specifically they work for and what best practices are. And again, I know that's something that you've been focused on and trying to empirically ground our studies. So anyway, been on that journey, and then along the way decided to do some online courses to see if people were interested, especially internationally. And it's gone great. I'm meeting people from all over the world, and it seems to be holding water for people and useful. So I'm happy.
Great and good to hear. And for folks who are listening, I did have the honor of attending the first live online course that David offered on trauma-sensitive mindfulness. And we're going to dig into that a little bit. But before we start with that, one of the things that I wanted to ask about is just in checking in on that pushback. You know, I've spoken about just where we are within the discipline of mindfulness in the world in secular context for interventions like MBSR, MBCT, things like that. Knowing there are lots of different definitions of how mindfulness is meant to different people, kind of that's the territory that we're in. And how it's very interesting, even in my day job in the place where I work and also do mindfulness teaching and consulting there, the way you describe this, there is an appetite for this. And there's a bit of a slog. There's some heavy lifting to do to loosen those chains on mindfulness of breathing. And here's how we do it. And this is the right way. And saying, well, our intent here is about experience right now in a way that is not dysregulating and is hopefully even inviting for a person. And everyone's different.
Yeah.
And it's not just a couple people might have some problems with this. It's like, no, so why would it hurt to have alternatives? And instead of it being this particular meditation, how about it's getting in touch with our sensory experience or something else that can be really initially, from the very first step, inviting to those who find the right thing for them. So I'm wondering what kind of, even if it's been somewhat limited, what kind of pushback you've run into on this?
It's definitely the ongoing tension, I'd say, around. Yeah, it's a great question, and it's a tension point that I'm in from a couple of different angles. Maybe we could unpack it together. One is this idea, someone who puts their hand up and says, hey, this seems to be going fine for the last 2,500 years, 2,600 years around the breath without these particular modifications around trauma. Why do we think that we are reinventing the wheel? An understandable critique. And
understandable, though I would suggest flawed, and we'll unpack that, yes.
Yes, and that's actually what I would love to talk to you about. I think you have some certain angles on this. I was just having a conversation with Rick Hansen about this, who, Rick Hansen, for those that don't know him, has been, as I understand, someone who's had a pretty significant Buddhist practice for a number of years, but who is really interested in the dialectic between being with and working with. And that as mindfulness has been articulated inside of a contemporary context, it really, I'd say, hyper-focuses on this aspect of being with, which is massive. It's huge to be able to cultivate the skill of being with our experience. And then here's someone like Rick Hansen coming in and talking about much more around the working with, I'd say, trying to bring in elements around neuroplasticity and talking about his piece around taking in the good. Whatever we think about Rick Hansen's work, more what I'm interested in is this tension between when is it fine just to be with our experience, and when is it actually a moment to offer students some different practices, as you're saying, some different modifications. And then this ongoing question of, well, A, how would we know that it's the moment to actually invite someone like, hey, maybe actually the breath isn't the easiest place. You could try your feet. A, how do we know that? And then B, how do we make sure that we're not promoting avoidance inside of the practice? How to ensure, because to me, the practice is about being with more and more greater fluctuations of our experience, whether negative, positive. And so I think one of the things that's happened since we last talked is that the work around trauma sensitive mindfulness can be misconstrued to say we're just trying to keep everyone comfortable.
Right. It's not.
So I don't know how, yeah, those are a couple things I'm seeing around these tension points.
Yeah. Yeah. There's so many wonderful, rich layers to this. I'm glad we're diving right into that, because this is one of the things I love about talking with you about it. One of the things that I've noticed that's been a bit of a gap in how we approach MBIs is that we tend to start with a practice. Even if it's a welcoming practice, a settling practice, people say, no, take a breath and notice where you feel it. And to me, already we're in a point where this could be problematic. And so what I've been looking at is, what would it look like if instead of starting with a practice, even if it's something like 3-minute breathing, it's still a particular thing, or 3-step breathing, however you want to look at that. What if instead we taught people, without going into a meditative practice, what if we taught people how to check in, check in with how they're doing, a meta-awareness of their own state of regulation right now? What are you noticing in your body? And it doesn't have to be a meditation on that and a deep connection with experience. It can be a peek, kind of like when you're a kid and you're in a scary movie and you're covering your eyes, and then you just kind of take a peek. It's not as bad. Well, that can be so with our experience of noticing, okay, I got some butterflies in my stomach, a little tension in my shoulders, and we can provide that initial,
right,
what's it like being you right now? And this is just a peek. And if you feel yourself maybe getting a little overworked in this, it's perfectly fine for you to stop. Or do something else and give many of the options that are part of your course that you recommend. So one of the things I have been experimenting with is, how can we help people who are new to this, or more likely, because in the last course I started, absolutely everyone who is at orientation raised their hand about already having some experience with meditation. In some ways that's wonderful, and in other ways that means, okay, I got that many more people that I need to unlearn or have them set aside what they've already got in there as their grooves of practice.
Absolutely.
Which is another kind of challenge. So really, I want to focus on a checking in, so that people have some competence with noticing how they are. Am I starting to get dysregulated and not challenged? Be very clear that we're not trying to say, as you were just mentioning, we're trying to make this positive and okay and comfortable for everybody at all times. It's not that. It's being open about, this can be challenging. And there's going to be moments where there may be difficulty in being aware of that and knowing when it's time for you to, this is like a good exercise where I'm getting my workout for my practice, for my heart, for my mind. And when it's, no, this is too heavy and I need to lower the weights and get back to my window of tolerance a little bit more.
It's a great metaphor about lower the weights. I like that example. And it's come up recently. I think we might have talked about it in the introductory course, but this idea around trauma and mindfulness being in some ways like an injury in rehabilitation, in that, we could think of trauma like an injury. And for some, it's a moral injury. For others, it's a deep physiological injury, but it really is an injury for people. And then mindfulness and meditation, as and then I imagine many of your listeners know, that's a really powerful thing to ask someone, especially in this current climate, to actually pay sustained attention to their experience in the present moment. That is a very powerful, what I'll call exercise here. And I'm putting that in air quotes because I want to stick with the metaphor around the injury and the exercise. If we're going to ask someone with an injury to do a particular exercise, and a powerful exercise, I think we want to be cognizant of how are we asking them to do that. You know, my mom broke her arm this year, and I really watched her go through this experience of physiotherapy, and that there were gradations of movements that she could be in, and she was asked to really follow her window, meaning when did she feel like she felt a fundamental okayness, like, okay, the pain's tolerable, and when was she outside of her window? And I think this can work inside of meditation. And then as you're speaking to that danger, I think it is a potential drawback of what I would say is a culture of what someone just defined recently as safetyism. Which is a term I hadn't heard, but saying that there has been such a deep focus around a hyper focus on safety, often on campuses these days, around trigger warnings, things like that, which I think can actually be unhelpful for people because we're taking away the possibility of them gathering strength and resilience through difficult experiences. So anyway, we're just in the soup here, and how do we navigate it? And I feel like you and I have been in this conversation.
Yeah. And it's, in some ways, it's really wonderful because we'll never be bored on this.
No, it's so true. It's so true.
And acknowledging that the experiences that people are having, participants in programs, is going to be unique. And that for some, what will be a very simple, this is not dysregulating at all, I'm feeling great about it, I'm immediately getting into X kind of state that I'm looking for, okay, that's fine. And this is more challenging for me, there's something else that I need to do. And that is also equally something that we can work with.
Yes.
But like that rehabilitation, like for your mom on the shoulder, they didn't start with really heavy weights and way outside. And it's like, no, let's work into this. And doesn't mean there's still not discomfort or even pain, but also checking in with how I'm doing. And that's why I think there's some value to exploring what does it look like to have people develop some initial competency with just checking in and seeing where they are before going into, okay, now we're in this practice, and still having the metacognition around how I'm doing without that stealing away focus from the experience itself. That's the challenge.
The trauma specialists that I know would, I think, be really supportive of what you're talking about here, of gaining that competence in the initial stages of a practice. That's not taking away from mindfulness.
Right.
I was talking to someone named Babette Rothschild, who's a trauma writer and specialist. She wrote an amazing book called The Body Remembers. And she would say, I think, I want to put words in her mouth, but what you just said is a very positive leveraging of mindfulness and the container around practice towards self-regulation. And what a powerful thing to offer someone that they could use really for the rest of their lives, if that's not a well-worn tool of saying, what do I need right now? Maybe I did it this morning here in my practice. It's been a challenging time for me around some health stuff. And I really took a couple moments to say, well, I could immediately go to the cushion for 20, 30 minutes, or let me just take a moment and really check in and go, what's needed here for my window for self-regulation? Again, not to be comfortable, not just trying to steer away from what's difficult, but really to say what is going to support my nervous system and what's going to support my day ahead. So I really appreciate that you're starting there. And I don't want to steer the interview too much, but I am curious how it's going. How are you finding when you're starting? Are people responding well to that? And or what your experience is?
It's interesting. I think this ties back to what you brought up earlier about kind of the state we're in about mindfulness, and that, it's worked fine on the breath for thousands of years. Why change it up? As a skeptic, I would push back on that a bit and say, how do we know it's been okay for 2,600 years?
Well, that's bold. I appreciate
even in our own, and this is a conversation I have quite frequently in another context, is how do we know that's so? And even in recent years, and of course this is along with Willoughby Britton's work, and Willoughby was also just a guest on the podcast, so David, your episode is a little bit before this one coming out, is around the there isn't necessarily good tracking of people who have very, very poor experiences, maybe very dysregulating experiences, maybe chronic issues that they become chronic issues or severe issues. If they leave a retreat, how many retreat centers track that? Mm-hmm. And I would say I don't know of a log anywhere in a particular tradition that is strong with meditative practices that has a running log of, oh, but these 5 people had really big problems while they were on the Rains retreat for 3 months. That isn't anywhere there. It doesn't mean it didn't happen. So I would also suggest that this is not 2,600 years ago. This is today. Our world is maybe a little bit different in some ways. Doesn't mean that suffering doesn't have the same kinds of roots of having what we don't want and not having what we do want. They get that. They agree with that. Where I would suggest is, because it has been this way for a long time, doesn't mean that there can't be room for innovation or for making things better. We know, and you especially know, that certain kinds of practices can be harmful at the wrong time and under the wrong conditions. It doesn't mean that people are prevented from ever engaging with them. It just means it needs to be under those right conditions for them.
Absolutely.
From it. And I think where we are with mindfulness today is we're still very early in the learning about these, and they do have roots in long-standing practices. And where I push back, even in my own mindfulness colleagues who say, well, the underpinnings of this particular mindfulness-based intervention is this religious tradition. And I say that's, although technically true, it doesn't mean that it's not also rooted in modern neurology and contemporary teaching methods and a whole bunch of other stuff too. And also that's not necessarily a good thing. Please, let's look openly at the history of that tradition. And we can still say, what might we do a little bit different and a little bit better here? And when they stop at the underpinnings being this particular tradition, I say, well, what are the underpinnings of the underpinnings? Let's go a little bit further back. And this is something, in these other contexts not associated with MBIs, I push back on, well, what's of value to me in this is how it shows up in my life. In this world here now, there is tremendous value here in this. And it's based on my experience as a human being, not because it's a particular ideological stance or religious belief, but because of how it shows up in my life. Those are the real underpinnings, I think. So pushing on that is not stopping at, here's how mindfulness of breathing has to be done. Not necessarily so. Here's how a compassion, loving kindness kind of practice has to go. Not necessarily so. What else might we do in ways that are going to make this really reach people with the same integrity to transformation, and also be something that is not going to throw people into a tailspin or have a lesser chance of that?
Right. This is what it asks for those of us that are offering mindfulness instruction to others, or any those of us practicing. It asks, I think, us to draw on our ideally the competence we've developed to be present in the moment and respond effectively to what's needed. And I mean, I'm coming in particular with a lens around trauma from a Western psychological tradition, and I have some clinical training there. So that is the lens of which I am entering into this conversation that we're having. And then, so when I hear you talking about these underpinnings and tenets, this is really the lens that I'm using. In my experience, trauma requires us, especially if we're in a position of leadership, to stay present and to listen deeply. So for example, the skill, if I was leading a body scan practice in mindfulness-based stress reduction, and I noticed that someone was having potentially a difficult experience, or at least my observation told me, oh, they're wincing, they look like they're dysregulated. Is there a way that instead of following a script, I could actually respond skillfully without othering them, to take care of the room? And luckily to me, mindfulness practice supports that ability to stay dynamic, to stay present, and to not assume it's a cookie cutter approach. And again, I can understand the pushback that says, well, this is just this Western individualist thing that needs to tailor it to everyone. Oh, we have to have it special. And I do think there is a middle ground here that I also feel you're occupying, of saying we can have choices and we can still have a container inside of practice. And that will be powerful for everyone in many different ways.
Yeah, I agree. And I think one of the difficulties is a common experience I've had is in teacher training programs, is that folks who are on that path are always asking, can I get a script for X?
Of course.
Didactic or the especially the guided meditations, and completely understanding that can be very comforting, and that can be a great guide for people. One reason in which I tend not to offer that doing teacher training or mentoring in this is because then it very quickly becomes a checkbox. I've got that. I don't need to know it myself. And
right.
Without that, you can't then be that live, responsive way in which you're describing.
Yeah. And people feel that, I think, and as you're saying, dignifying the want and the need for some structure and understanding, well, how do you do it? And then that ability over time to be able to kind of loosen the grip on the wheel, loosen the reins a bit, and really respond to what's happening in the moment.
Yeah. So interesting times coming. And what I want to do now is just talk a little bit about the courses. You've recently had what I would call a very successful course on trauma-sensitive mindfulness live online. I took it myself. So for those of you listening, full disclosure, I took it. I thought it was great. You should too. And David, from your perspective, how did it go?
Thanks for asking. And I really appreciated seeing your face there. That was, I wrote you an email saying it was just warming that we've had this kind of ongoing discussion happening over years as colleagues, and to see there was awesome. And I'm really happy with how it went. And for listeners that don't know my story, I was very focused on practice and meditation practice and going on retreats for a long time, and then ended up having a personally challenging experience on a retreat that really opened this conversation for me. And I hold no ill will towards teachers or the traditions that I've practiced in. And one of the commitments I made was, I'm going to do everything I can to ensure that a young person, or of any age, who's on a retreat and experiencing traumatic symptoms, that they are recognized by someone who's a teacher, and that they are supported. That's the base level commitment. And so that's what the introductory course was to say, what would be the collective competence? What's the bar that we want to set inside of a mindfulness community to respond effectively to trauma and prevent re-traumatization? And I feel proud of the fact that there was a lot of scholarships on the course. To me, it's about this work getting out there. So if anyone wants it, then it's like, great, let us know. And of course you can come, you can do the course. And so it felt really meaningful by the end. I mean, I was quite honestly, I was white knuckle gripped through the whole thing. I'm like, I hope this, just that we did it all live on Zoom. And I had never spoken to that many people online. And so I was just hoping, honestly, that we could land the plane. And the feedback we got is that, people, they got something out of it. And I feel really great about that. I feel proud and excited, and that I don't have to know everything, and that we're in an ongoing collaboration and discussion in the community. I want it to be evidence-based. It's really growing. And then we decided to launch a follow-up course, which I'm happy to talk more about if you want. But I do feel really proud of that first one, and I'm glad that you were there.
Yeah, it was a really positive experience. And it was, for the folks that I saw in this, they were they were really engaged with what was happening in
Yes.
every single class. And it was so wonderful seeing a lot of familiar faces that I know within this discipline and area. Uh, and that itself showed the breadth of the interest in this topic, that this is not just some niche idea that isn't really part of it. And I'm like, no, this is really quite important to the
Yeah.
discipline of how we care for our participants. And that is one of the most important things, is making sure that their well-being is still, there's still challenge in what they're wrestling with, because they're coming to us with some difficulties for much of the time. And how do we work with that in a way that's caring and responsible? So I think that was really great. And there are a number of other capabilities you included with that, including some discussions, some live group discussions. I wonder if you might describe that a little bit too.
Yeah, happy to. Well, we had it set up as a 5-6 module course, really covering core tenets of, okay, so if we're practicing, or especially if we're offering mindfulness, what would we need to know in order to keep people safe? And again, I put safe in air quotes, because we can only we do the best we can. And so we can't guarantee safety, but it's a powerful thing that we're asking people to do. If someone approached, say you, Ted, in a class and said, I feel really scared at the end, or I feel vigilant, or I notice my heart's race. If we have someone that we sense, okay, this might be that they've experienced some trauma, and that their nervous system's dysregulated, what could we offer them? So we did a classroom session where we talked through one of the different recommendations, and then we'd open it up and have a session of people getting to ask questions from their different locations. So one quick example would be talking about the double-edged sword of mindful attention when it comes to trauma, that it can be very helpful to pay sustained attention to traumatic sensations, for example. And there's other times that over-attending to sensations can cause someone to become really dysregulated. So, okay, well, what do we do? What can we work with that? So the classroom module was to say, well, why does that happen? Why is it a double-edged sword? And then it was so fascinating to hear people asking questions from many different locations. So someone who said, I work with people who, often young women who have eating disorders and have experienced trauma. Often we're working with the breath. When they're focusing on their breath, that's really connected to their respiratory system and often their digestive tract. That can be dysregulating. So what would you say? And it was amazing to just hear things that I had both considered, but I think things I'd also never even thought of, that particular question. So it was a fascinating chance for the community to come together and to really get to, in a grassroots way, resource each other in these questions and stay alive with each other. So that was my experience of it. I don't know if you want to say anything about your experience.
Yeah, I'd say one of the things that made this unique in many online courses is that you had this active and thriving community that was independent of the formal class time sessions. And so you had the formal classes, which is primarily didactic and some discussion, and you covered questions that people had submitted, but then it really became a strongly supported grassroots kind of effort when you had these other practice sessions for people to get together, in that community building served in a number of ways. First, just exposing each other to other circumstances that we haven't run into in teaching and practice. And then with that comes the awareness of, oh, and here's ways in which I might deal with that.
Mm-hmm.
And what has happened, and other ways that I might really question ways to deal with it might not be as effective or helpful. And all that while it's building connection with others who are in this. So it's, again, you have the support of the community itself, and you have just those bonds of mutual support and people doing this work and caring about this work. So you're not on your own. I think that was one of the most powerful things about having those sessions.
And yeah, for me too, but the care, that was something that it's still a takeaway for me, is that it wasn't, sometimes I think a lot of us came in and said, well, I don't want to do harm, understandably.
Yep.
And so then it could end up being a kind of a fear-based learning environment. Like, well, I don't want to, step on the wrong,
Right.
versus where I think it went was that this is an empowering framework that says this doesn't take away from the power of mindfulness. On the contrary, this is actually saying, I think, the more that we know, the more nuanced and complex we can be about this, then the more we can respond skillfully to people's different experience. So I think people were empowered in the connection as opposed to worried that they were going to be causing trouble.
Yeah, it was more about what is the best thing I can do and how I can be for my participants, even though it may have started as not wanting to do wrong. It became something else, more of a positive way to support those who are in my programs.
Yeah, absolutely. Absolutely.
So I'm curious what prompted you to have the course itself, because you've got your work and you've got the book, which has been doing beautifully. And so what made you think, oh yeah, now a course, I got to take that on.
Yeah. Well, I appreciate the question. I was finding that the live, two things. One is that doing travel and teaching was both rewarding and at times could be exhausting.
Yeah.
With the actual just travel, getting on planes, the carbon footprint of being on planes, and also just it could reach a certain number of people. So say I was flying to the East Coast of the US and would meet with 50 or 100 people, and it's exciting. It's amazing to be live. And then the potential reach of the online course was just too exciting I just was so curious, like, let's try this and let's see does it translate well. And then I also was curious to see, it feels like trauma sensitive practice is a live and dynamic living organism. It's not just, and the book wasn't, here's 64 modifications, go. It was, let's put this on the table. And I'm not the only person, of course, that's talking about trauma sensitive practice. We have people like Trish Magyari, who's been doing trauma sensitive mindfulness research for years, and Elizabeth Stanley, who just wrote a book called Widen the Window. So there's
just had her on a couple of months ago.
Oh, you did? Great. Oh, awesome. Yeah. So, I wanted it to feel like a living, dynamic, crowdsourced methodology, I'll say, not prescriptive. And so that's why also the live program and doing an online course felt like a way that it gets to stay living and gets to stay breathing and change and evolve, and I learn over time. And so I can still hold my own in the chair, but I can also still open up to the community. And I really enjoyed that dynamic process. So that's why we said yes. I have to say, halfway through it, I was like, this is crazy. Why have I the technology and,
right,
these things can go wrong.
About the time that happens. Yeah.
Yeah, right. But I enjoyed it. I feel like, okay, it's one, especially as we go in the way of online learning just being such a powerful way to connect together. I thought, I want to just give this a shot and see how it feels.
Mm-hmm. Yeah, and that's one of the things that I've always really encouraged people who are hesitant about going online for teaching their courses is you're no longer constrained to a geographic area. Those people are still included. They're still eligible to take anything you do online, but you're opening up to so many different perspectives. And as I mentioned to you, of course, I'm starting this coming week as of this recording. It has at least 16 different countries there.
It's amazing.
That means wildly diverse perspectives on what we'll be talking about, which is simply wonderful. That's the richness of this learning for me as the teacher, let alone the other participants in the program.
And when has it ever happened in history? We're on that edge. We're always on this edge, but with the different functionality now, the increasingly strong functionality of the online forum, again, it's not, I don't think it's a substitute. It's a different track, a different lane. But yeah, to imagine 16 different countries, regions pulled together, people having such wildly different experiences and the ways we can learn from each other, I think it's potentially really rich. Yeah. So that's exciting to hear.
So what were some of the challenges you had pulling it all together? There's logistics, the website, how you dealt with all of that. How did that go? What did you run into?
I think the biggest challenge, well, besides just besides just, literally working with technology and all the different mischief that can happen around, you know, on the Wi-Fi signal cutting out, or, besides just the obvious problems, I think there is the added challenge for all of us in an online forum to create a sense of community, and to leave people in choice. So the most exciting and difficult challenge, I'd say, was to create a trauma sensitive environment around an online class. And by trauma sensitive, for those who are new to this work, it's that we're really just being sensitive to the needs of people who are struggling with trauma. And, one of the things I would learn is someone said, you asked me to come on camera and I didn't feel comfortable with that, which, in retrospect, I can totally respect and understand. And so how to leave people in choice, and then how to create a sense of community while at the same time balancing people's need for privacy. It was just an ongoing dynamic dance through the whole thing. And I think we learned a lot as we went, and people were patient with us as we figured it out, and we seemed to have landed the plane. But yes, it was that desire to create community that was, I'd say, the biggest challenge.
Yeah, and I like the way you phrase that about having people have choice,
Mm-hmm.
and that's a big part of it. And again, it doesn't mean that we don't establish some welcome to challenge yourself and do a stretch without hurting yourself.
Yeah, that's so well said. It's just that simple, isn't it?
Yeah.
Yeah. Yeah.
So what are some of the things you were most pleased with? At the conclusion of the program, you're through the big heavy lifting of getting that program done. It's all complete, and now you're working on the next. And looking back, what are some of the things that stood out for you as like, wow, that was amazing?
Hmm. The thought that we had over 500 people in the course, and the thought that there are now uh, that many people with a base level competence around trauma. Some of them came into the course with some experience, of course, but others didn't. They were really new to the topic. And to get some feedback from people that said, I now think about my instruction differently, or I get emails that say, I would have chalked this up. I would have chalked this experience up to someone's resistance. But actually, in this case, I'm now thinking about it differently. And I'm really dignifying the responses that people are having to this very powerful practice. The thought that that is now just in the world and out there, and that it's increasingly in this matrices of different webs, and connecting with different people, and the thought that there might be a student, someone new to contemplative practice, who has a different experience, that's for sure the most rewarding thing. And just say one thing, I was talking to Willoughby Britton, who you had mentioned. Willoughby's a colleague, I know a friend and colleague of yours too, and I was lamenting about the challenges of how to create positive learning environments and structures. I was just really I've been in the stress of the lift, as you said. And, Willoughby said, she said, well, what if the work is just done in some ways? Like, what if that was it? And now, you Ted, were a part of this, just having a trauma-informed discussion be a part of the zeitgeist, to be part of the discussion, really. And now I think people know about the term trauma-sensitive mindfulness. It's more rare that someone hasn't heard about it. And Willoughby was just, kind of made this joke and said, well, what if that's it? And for me, I feel still compelled because I'm excited about the topic and for my own learning. But there is a way that the die has been cast, I think, and now it's going to go wherever it'll go. People will take modifications in different countries and work with it in different cultural contexts in different ways. So I feel most satisfied about, I feel like we did well by each other. We did our best to just be in integrity with each other and come from a well-intentioned place. So I take a lot of heart from that experience.
Yeah. And I think you're right. And nod to Willoughby that she is right in that as well, is that this is now becoming, thanks in large part to your work, something that is now part of the considerations of programs. Again, in another space, people were asking, well, as we design this new course X on mindfulness, how do we make sure we're being, trauma sensitive or trauma informed was where they
Right.
were using. And
Yeah.
say, well, I might have a few ideas about that.
Yeah, that's great. That's awesome.
And yeah, just so being able to do that, but that it was brought up elsewhere, that this isn't something that I had to, as is often the case, say,
Right.
hey, can we maybe look at some considerations here for the well-being of the people who are participating in our programs.
That's awesome to hear. That's
So I
great.
agree. That was also a really strong and powerful part of this. And it's not stopping. There's more to it because you're also working on, and will soon be, as of this recording, will be coming out, I think later in this month, is a follow-up advanced course. I wonder if you could tell us a bit about that too.
Yeah, so this reflects a couple things, two things.
That's not too activating, knowing that it hasn't happened yet. And
Yeah, right.
Blog right now.
I'm out of my window. I was like, oh God. I'm working on one particular final script today on it. So, it's not too activating. Here's why I wanted to give this a shot. And it's two reasons. One is that a number of people finished the course and they said, okay, the introductory course that we've been talking about. I said, okay, I feel like I can now offer practices in a safe way. That was really the kind of quote unquote first do no harm focus of that introductory course. And then a number of people said, well, where from here? What are the moves? If I am working, especially, a number of teachers said this, said if I'm working in what I would say actively traumatized populations, if I'm working in spaces where I want to be cognizant, what can I do? And then honestly, Ted, this was also my own interest and path about what are the practices that set up the conditions for trauma recovery. Now, I think it'd be irresponsible to promise trauma healing inside of an advanced course and say, oh, I just throw mindfulness at it. What could go wrong? I think as you and I both know the trail of bodies that, or it's a terrible metaphor, but we want to be careful there.
Yeah.
And honestly, for most of the rest of my life, I want to be focusing on the combination of mindfulness, of contemplative practice, and the power of sustained present moment awareness with what to me has been some incredibly useful and powerful skills that are often taught in trauma contexts or clinical trauma contexts that I think have major implications and that don't set people up to go, oh, now I know how to heal trauma,
Right.
but in fact can empower people to say there is another step that people can learn to work skillfully with trauma and create the conditions for healing without just claiming like, oh yeah, we're gonna just mindfulness and meditation is going to help you heal. It might be a part of it. So the punchline of the course is mindfulness is helpful, really, and trauma survivors often need something more. This gets back to that working with, being with. We need to be able to be with, and there's a whole number of competencies that we need to develop over the course of our lives that will be really helpful for everyone. So that's the plan on what we're going to get up to.
I like this because it brings in the idea that the introductory course is bringing people who may already be in a situation where there's tremendous difficulties. That's the starting point. That's their baseline.
Yes.
And how do we acknowledge that, knowing that even in a heterogeneous population, we're going to have a certain percentage of people who are likely to have a history of trauma in some way at some level on the spectrum. And in particular, for those who are in an area where you're likely to have a higher percentage, where you're offering a course specifically to a population that is suffering from stress, anxiety, depression, or something. Well, that comes from somewhere, and it may be trauma. So you might expect reasonably a higher percentage, so that awareness becomes all the more important. But it's not just okay, so we've got the trauma aware, trauma informed, trauma sensitive, and we know how to deal with that. And great, we've got people to a point of treading water. But now how can we help folks be able to swim or maybe even stroll up on land, get them in that direction? One of the things I'm curious about is that challenging line that is often unclear, and I think some folks sometimes cross between this being therapeutic, I'm doing a mindfulness intervention that is therapeutic, but I am not a therapist, and we're not doing therapy here.
That's right.
And wondering how that may be showing up in this course, because a number of the folks, right, some taking your first course, and I imagine the advanced, are therapists. Others, like me, are not. And
Right.
want to make sure we're clearly observing those boundaries. So I'm wondering if you might say just a little bit about that.
Yeah, I really appreciate you asking it. And that's one of the, in some ways, slippery and dynamic things, is that there are clinicians, there's trauma therapists who are taking the course. And in that case, I'd say, well, all power to people that are wanting to work actively with trauma. And then how do we know when we've hit the edge of our circle of competence? And to say, I'm not going past that. And if you don't know trauma well, then how would you know that
Right.
it's necessarily there? It's confusing, it's tricky. And at I'd say at a foundational level in the introductory course, it was learning that more isn't necessarily better when it comes to mindfulness practice and trauma.
Right.
So if someone comes to us and they say, I had a traumatic experience, I have these intense sensations in my stomach, that the meditation teacher doesn't say, great, just keep focusing there and eventually the tangle will untangle.
Yeah, if it's just sit as the answer, I got to push back on that. That
Exactly.
may not be the answer. This may be a medical condition for one thing.
Right, exactly.
Other stuff
Exactly.
on top of it.
So that's, I think, the consciousness raising, which you and many others have been a part of just ensuring that we're not just using a hammer and thinking everything's a nail. But then I think you're asking a really important question is, okay, if we start then getting into the territory of more advanced skills, what are the promises that we can ethically make? At what point should someone make sure they're under the care of an individual practitioner? I think that's more slippery. But the answer I'd have, which builds on the introductory course, is we all have what's known as a window of tolerance, where we can actually, it's also known as an optimal window of arousal. And trauma will often cause us to experience dysregulated arousal. So too much, too little, we're flooded by sensations, traumatic memories, or we're dissociated. So that's a core framework we can use. And if you're working with someone who is consistently out of their window and practice is not supporting them to what's often known as re-regulate or come back into a window that feels tolerable for them, absolutely they need to be working with an individual practitioner. But I'm curious, Ted, I'll put it back to you here. I'm curious how you're thinking about these days. You know, in a course and framework such as mindfulness-based stress reduction or mindfulness-based cognitive therapy, someone with active symptoms of post-traumatic stress disorder or of an active diagnosis of PTSD becomes an exclusion criteria inside of a course like mindfulness-based stress reduction. And that is I have mixed experiences around it where I know people that have a PTSD diagnosis and said MBSR was very helpful for them and they actually needed it, but they needed to know certain modifications that help them work safely. So I'm just curious how you're thinking these days about, what was your answer to that question around what's the boundaries? How would we know when we've hit the edges of our competence?
Yeah. So it's a couple different layers. First is for people who are applying to a program. And I'm very clear that when people are applying to one of my MBSR courses, it's not you're registering, you're applying. And that application process involves us having a conversation around if this is the right time for you based on where you are right now, what's going on. And that's, of course, something I took from the wonderful teaching I had at UMass Medical School Center for Mindfulness on how to teach this stuff. Let's be careful about it. And from my own personal experience of my own history of trauma and wanting to make sure that this is the right time, because I've been in situations where the answer has been just sit through it, and that's been wrong and harmful.
Yeah, right.
So with the context of someone applying to a program, having a methodology in which we have the conversation. And so one of the things I don't call them exclusionary criteria, because that seems to be putting in a firm in cement, if X, then no, you can't. And they're like, no, it's a conversation. Because for some people, I'll give you two different examples. One individual had recently had a significant loss in their life. A parent passed away just a few weeks before. And in that conversation, they were clearly, even in just this talk about how are you doing, what's going on, they were already really what I would suggest is outside of that window of tolerance. They were already in dysregulation, and they were not seeing a therapist, they were not in treatment. So one of the challenges for mindfulness teachers is I think it is necessary for the integrity of your program and for the well-being of the people who are coming to you to first have that conversation, have that vetting. And it doesn't mean it's exclusionary and they're a no. It means you have a talk and see how they're doing. And in this case, it was, this might not be the best time for you. And how about therapy? Because right now, for the situation you're in, that has shown to be more effective in helping you with where you are right now. So for a teacher who's trying to get people in their class, you have an ethical obligation to get people in the right direction, particularly if they are suffering from some form of great harm or trauma like this. So it may be you saying, this person isn't going to be in my program this time. And that's okay, because they need to get another kind of help that's beyond what I can provide them. So getting them into therapy, I think, is absolutely, and recommending that, it's not something we can force them into, but making a recommendation based on the evidence of how that can be more helpful. A different circumstance is an individual, same thing, actually lost the same gender parent. Their mom had passed away within the past couple of weeks. But the conditions were very different. This is a person who was, and still is, a therapist, had been expecting this for quite some time. It was not out of nowhere. Their parent was in hospice for the past several months. And they had already worked through much of the difficulty of that situation. And they have their own therapist that is actively encouraging them to be in the program that they want to be in. And we're going to be checking in each week with how they're doing, and they're regularly seeing their therapist. So for that person, it's a welcome to the program, and we'll make sure that we continue to see how you're doing, because not just your mental health, but your core well-being is very important. So there's the complexity of it depends. Of course, that's there too. And the other part of your question is around how to kind of draw that line between what I, as a not therapist, what a mindfulness teacher can do. And this is, again, in my day job, something I do, of how do we distinguish that between coaching and the coaches that I'm teaching and delivering programming online, and when is it, so we're not doing therapy here. And making sure that they can say, I, as a coach, or I, as a mindfulness teacher, here's what I am here to do.
Right.
To help you along this path, and here are the things. And if there are areas where you're running into greater difficulties, of course, work with me on that. And it may be that we can connect you with other resources that can be helpful to you in ways that I can't. And it is really a necessity for a teacher to acknowledge that difference. When we get into a therapy kind of situation, is, to me, one hallmark of that is when it's more about the story and the history. When we're getting into that, then that's therapy, and isn't within the ballpark of, okay. And in MBSR, when someone starts telling a story, there will be, I will interrupt them and say, noticing in your body, and still honoring, the circumstance happened. Right now, what we're doing is just getting in touch with how it feels. How do you notice about it in your body, your emotions, your thoughts? And so we shift towards, in CBT, the cognitive triad is very much in alignment with what we do in mindfulness programs. And that's okay. And that's about at the edge. And then when it gets into, oh, but I had this experience, and like, okay, then maybe more a therapeutic situation, a therapy situation, formal therapy situation might be more beneficial to that person.
I really appreciate the example that you used, and of the two different kinds of loss that were totally contextually based, and that's a fantastic example, because when I've talked about exclusion criteria with, for example, mindfulness-based stress reduction teachers, we often have a moment where people look at it and they go, well, no one would come. That includes me. I'm in the exclusion criteria, and yet good reasons that they would be there. And so, as you're saying, like having that conversation, and I think, Ted, the way you're speaking to it is a reminder that that does not need to be a shaming conversation.
Right, right.
It's exactly what you said about coaching. It's saying, here's what I can do. I mean, you could lead with here's what I can't do, but ultimately I think we can get practice at saying, if we're having, for example, this conversation with someone at the beginning, I love what you said about the application, to say, my commitment is to support you, period, full stop. And I'm going to tell you, based on my assessment and my experience I actually think you're going to be best supported here through some one-to-one work. And that doesn't, there's a way to do it that doesn't say, you just got to go to therapy. You're broken. I think there's a really nuanced way that we can learn how to do it. And,
that we don't feed the how that is perceived in our culture, which I think is changing, but still has a long way to go.
Absolutely. So I appreciate you bringing that in.
Yeah, thank you. So what else would you like to share with listeners before I let you go?
Well, I feel like it's a really important time to be having this conversation. And I appreciate having it with you. And there's so many different directions we can go. But I think the Venn diagram of mindfulness, meditation, and then on the other hand, the study of trauma, and then that circle in between is a place of significant value right now, especially given some of the traumatic or at least adverse experiences that are happening internationally right now. I mean, as we're talking, we have coronavirus rolling across the world, and this is where we started, so we're full circle here, but talking about the ways that traumatic experiences are really coming to the foreground and how to leverage mindfulness practice towards expanding our window of tolerance, whether that's individually or collectively. So I feel excited. I don't know if that's the right word. I feel motivated and committed in this moment that we do well by the trauma that is present collectively, and to stay in our window and stay in our range, to not just assume that we can go big or go home. It's actually a matter, if anything I've learned from trauma, it's that less can be more. So I think there's a way that we all need to be assessing individually what we can handle, in a family or community, what practices are going to support us there. And I just feel really moved to be able to talk about best practices with people like you and teachers who have been really in this conversation around the intersection of mindfulness, stress, adverse experiences, how we work well around regulation, what do we take from neuroscience. And so it's a to be continued moment to me. And I'm excited to see where we go.
Thank you. So for folks who are listening, I'm going to have links on the episode page to David's site. Be sure to check out his podcast that's on there as well, and a link to his book. Our guest today, David Treleaven. Thank you so much for being here. Good to see you.
Thanks, Ted. You too.
Thanks for listening. If you'd like to learn more about something you've heard in today's podcast, please come and visit the website at presentmomentmindfulness.com. You'll find an entire webpage devoted to this and every episode. You can comment on the episode page and find show notes and other helpful resources for your mindfulness practice. The shakuhachi music heard on Present Moment is used by permission and through the generosity of musician Rodrigo Rodriguez. His website is linked on the Present Moment website on the About Podcast Music page. Until next time, remember, every moment you have a choice. Make it the best you can. See you next time on Present Moment.